We spent the last 10 minutes talking. We treated this in 10 minutes, and she responded very well. The entire foot complex can now abduct. If I block the ankle joint, the talocrural joint, I can still abduct midfoot, forefoot. If I capture the calcaneus, you can see that subtalar abduction is at least 10 degrees. Now I'm going to test valgus of the heel with the talocrural unconstrained, and you can see she goes past neutral. I'm only pushing on the heel. And if we constrain the ankle joint, the talocrural joint, you can see that when I take the calcaneus into eversion, the whole foot follows, and that's pretty normative when you compare that to this side. Relax. And here is abduction of the two joints. And if I constrain the talocrural joint and just focus on the calcaneus, she abducts this much. Well, it's easier to show you that when she's laying on her stomach. The navicular was very constrained, as was the whole midfoot, and now you can see the midfoot goes very freely. The cuboid was very restricted. That's now moving, and if we spring the malleolus, taking up the slack posteriorly, there's a little bit of give. Same thing in terms of superior glide of the fibula, a little bit of yield there, and the same thing for the fibular head, which I'm going to show you with her lying on her back, and then also lying supine prone. So I can take up the slack and spring it. Distinct mobility. Okay? Let's test your strength now. Pull your foot up and out on this side. Don't let me break it. Show me how strong you're going to hold it. Can't break it. Line your stomach with your feet off the edge. So, Band-Aid shows us which was the affected side. This calcaneus now, she doesn't have a lot by design at the factory. It's how she's made. It's the same as the other side, but it can go there now. And in terms of the transverse plane mobility, she has a lot of it, which is good that she has that. If she, lacking the eversion, it's good that she has a lot of transverse plane mobility. And if I block the malleoli, then we are focusing only on subtalar abduction. And you can see that she certainly has 15 degrees or so. I'm going to spring the fibular head here. The fibular head, shaped like a fist. So you can have one that is rotated, okay? Rotated posteriorly. And yet, when you palpate the front of it, my fist starts off on the table without indenting the table, and I'm rotating to where this is very prominent now compared to the other side. And yet in the front it's still equal. So I never trust what I see supine. I always test posterior, have both limbs in the same position, and it's not just about how it feels, how it looks. It looks more posterior. The question is, how does it move when passive forces are induced? So we take up the slack, and there should be a little tiny bit of yield. It's a very strong joint, but it should nonetheless still have some yield. And this side was very, very rigid, and I can now put some force through it. Okay, so can you give us a little bit of feedback, please? She just took a small walk, and go ahead and sit up and tell us your thoughts.
It's feeling a lot looser. I will need to walk on it and kind of see how that actually affects the pain that I was feeling in the lateral foot. But it clearly is moving more than it was.
And so, how does it feel when you walk now?
The main thing that I can tell, not being a doctor, is that I can actually put this on the ground more. It feels like my foot is hitting the ground flatter.
Underneath the first toe?
Underneath the first toe, the whole ball of the foot, underneath the ball of the foot, I'm able to actually put it all on the ground.
So can you move your foot and show us how you felt like it was before?
When I was walking, I never felt that there was much pressure being put here. I felt most of the pressure being, I guess, spread out.
Yeah.
Along the rest of the foot.
Yeah.
And not much, some, but not nearly as much as on this foot, hitting.
Yeah.
Here. And now I can feel it. I can feel it more.
Very good. Anything else?
That's about it.
Okay. So what's your kind of, I'll say, emotional response to this? How's what's your sense of?
My sense is that things feel like they've been mobilized. In the sense where there's a little bit of aching. I don't know how. I mean, we'll see how that subsides. I'm hoping that this is a solution to my problem, and that I'm not feeling pain. That I'm able to roll through my foot correctly and use my lower right limb as I should be able to.
We just filmed mostly the restriction. We didn't really talk about your presentation, but maybe you should give a sentence or two about how limiting this was for you.
Sure. So basically, when I came here, I was having so much pain, tightness in the peroneal muscle all the way down the back and along the lateral side of the foot. And I couldn't walk for more than 5 or 10 minutes without getting weakness in the toes and pain all throughout the lateral side. And it's limited my mobility and my ability to be active, run, walk, anything using my feet very much. So for the past five months, I really have not done a lot of physical activity, and have been just really desperate to find a solution because the physical therapist that I've been working with has not been able to put the pieces together correctly.
Very good. So we'll bring you back tomorrow morning, and we'll have a chance to look at it and see how it's doing.
Great.
So thanks very much.
Thank you.